Yeah, so I do want to talk about governance. I also want to talk about scale, and a little bit more about the rules. So let's go to governance. So um, you emphasize the human element of, as the title of your article indicated, the first group that you really focused in on was the clinicians. Um, how do you how do ideas for talk to us about the process? So somebody has an idea for a new set of data they want to take a look at, and some new information that would really help a process. How does it go from concept to at development to operationalizing it and maintaining it? Give us an idea of the life cycle of that whole process.
Well, I should start by saying that we're, fractionally through our execution of putting this in place. So we're not fully there yet. But as it stands right now, we spent a lot of time focusing on accountability and trying to make sure that throughout the organization we have the structure in place so that when we have a request, that all the pieces are lined up, ready to go.
Right.
And that starts out by we have our almost our entire C-suite is our steering committee, and they meet on a quarterly basis to set strategy around data governance. Below them, we have our data governors, and these are usually VP level and director level folks who have a specific domain that corresponds to their area. And then below them, we have the individual data stewards who do the actual work of understanding workflow and solving the data governance problems. And then below that, supporting all that, we have our Office of Data Governance. But we've built in the process where we can so far. So for example, we have a PMO now. And in our PMO project request process, data governance is one of the key line items there. So we have to get data governance to sign on and to sign off of projects. We've also incorporated data governance into ServiceNow. I'm not sure if you guys use ServiceNow when you're at St. Joseph's, but ServiceNow is basically a way to track the work that we do. And having that built in on those levels allows us to be able to get folks to utilize those tools, and then as a flow of that, it comes into the workflow for data governance. So for example, let's say you're using a report and you identify there's a data quality issue. You look at it and you're like, oh, these numbers are way out. This can't be right. Or you're looking at something even better, and this thing says length of stay. How are they defining length of stay?
Right.
What does that look like? They can actually log a ticket in ServiceNow. That day it pops into our queue within the data governance queue, and then it gets worked by the appropriate data steward that corresponds to that domain.